Welcome to Sovereign Souls, a special podcast sponsored by the Spirit Release Academy with your hosts, Jono, Webster, and Andy Porter.
In this episode, we have a very special guest, Kandice Crockett. Now, Candice has been working in the medical fields for approximately 15 years. She is now opening her interest to the spiritual world, and certainly the world that we work in, how energy can be cleansed and healed and how it can balance into the medical world. We'd like you to welcome Candice. You are very, very welcome to our podcast.
Thank you so much for inviting me. It's a pleasure to be here. This is going to be a really fun and interesting conversation.
Perfect. Well, thanks for joining, Candice. Again, really, from our perspective, you're not really sort of our target audience to a certain degree, because obviously you don't really come in to this conversation in this field from a kind of spiritual perspective, where most of the people that we tend to meet with do. So do you want to give us like an opener really from you as to what led you into this type of work and how you found us, I guess?
Yeah.
Sure, yeah. I mean, I've always been very left brain logical, always love math, one right answer. That's how it goes. Got fascinated with science, worked in the medical field. I was an ICU nurse for the majority of my healthcare career. I joined a couple of research teams doing different projects related to sepsis. And not only doing the work and realizing that we can change and improve practice, but just like getting that data, it really kind of scratched all my excitement of helping people and knowing that we have the numbers to support it. As far as getting into this line of work, I actually had a back injury. And I eventually had to get creative because the traditional modalities weren't working. And that led me to meditation and yoga. And I found a Reiki specialist on Groupon. As you know, our best practitioners are Groupon. And I went to this practitioner and I said, hey, I'm really stressed. I actually had this loved one that was kind of weighing on my heart. They had these really unique issues. And I'm like, I don't know what Reiki is. I don't know what it does, but I'm going to lay here and let you do your thing. And so afterwards I felt amazing. And they're like, you were mentioning your loved one. I think that they may have an entity attachment. And I said, that's weird. I feel great. Thank you for this, but I'm not really sure I want to talk about that yet. So I left, everything's fine. And then this person kind of got to the situation where they were just not doing well. They were in psychiatric treatment centers. And I got to the point where I'm like, okay, am I going to let this person come back in my home around my children? Like, is this someone that I need to really decide? And so before I decided to just call it quits on this relationship, I'm like, okay, well, let's try everything, right? So I take this person to this Reiki specialist and they do this really powerful thing. I was in the room for it and it was strange. There was like a little kind of movement or a little twitching. It was a little different than mine. And I'm like, okay, they're definitely moving some kind of energy. And she wakes up after and we kind of discussed like what was attached. And she smiled and was just this new person. This new happy person, lighter, freer, had healthy conversations that we hadn't experienced in the past. And with all of the medication and therapies and all this other stuff that this person had already gone through, I'm like, there's something here. Like, oh my gosh, I wish they would have had that 5 years ago. So then my science medical brain is like, how do we explore this more? And so I read all the books and all the research studies and all the other things. And of course, that led me to you all because you do have your background, you have a protocol. And in the medical community, the word protocol, that's important. You have to be have consistency with the way that you do things. And when I read about how you have 1,000 cases with an extraordinarily high success rate, I was hooked and I wanted to learn more. And I signed up for your class. And all I want to do is get this type of healing into clinical trials.
And that would be amazing. Thank you so much for sharing your background in this. But having come onto our course and seeing the way that we work and experience in that, do you feel that this sort of mainstream medicine industry is ready for this type of healing work now?
So that is the question. I think mainstream medicine is more ready than it's willing to admit. So the medical field in its history doesn't have a good reputation of someone saying, hey, I have this idea. And everyone's like, great, let's try it. Usually there's a lot of resistance. A lot of that's not real. That's hokum. That's mysticism. Let's let the spirit people deal with that. And so it really takes that evidence to move it forward. One example that comes to mind when I think of this work is germ theory. So back even before BC, there was this idea that there was this invisible thing, they called it bad air, that was affecting people and making them sick. The microscope was invented and they were able to actually see these microbes, but didn't really understand it. And so along came this doctor, Dr. Semmelweis, and he said, hey, we have this really high mortality rate in our birthing unit. I think that something was going on with the doctors because these midwives aren't having these statistics. So he initiated a hand washing protocol, and people were very resistant to it. But in his unit where he could control, they washed their hands and the mortality rate dropped. And this doctor, and let me tell you what the practice was. Like, these doctors would literally cut open cadavers and then go deliver babies without any kind of hygiene or hand washing in between. And so we think that that's crazy. Like, look on your face, like, obviously we're here now. But back then the doctors were offended. Like, you're telling me I'm hurting my patient? No, we're not changing. This is this bad air. So he ended up getting shunned from the medical community. He got upset about it and spoke even louder. No, we need to do this. Hygiene's important. Wash your hands. And he was committed to an asylum and died 2 weeks later. So this is kind of sometimes how the medical community reacts. But there are also other ways to do it. So Florence Nightingale is one of the most famous nurses. Anyone who's gone to nursing school studied her. She became a nurse and joined this British hospital. Okay. And military hospital, sorry. And she goes and she sees these soldiers and she says, this place is disgusting. They're in filth, they're dying because it's gross. And people, of course, are, there's no invisible thing hurting patients. No way. So Florence Nightingale kind of goes about a different way. She's like, I'm just going to kind of write these things down. And just because, I'm in charge of this nursing area, I'm going to do some different interventions. We're going to change the sheets. We're going to wash them and boil them in water before. We're going to clean some of these other things. And she, through her documentation, was able to prove that the mortality rate at this British hospital decreased from 42% to 2%. Just based on these basic hygiene. She also got kind of open windows and got like fresh air flowing through. So these things kind of started getting passed around. We were able to kind of understand bacteria. One doctor identified a specific bacteria with a specific disease. And then finally, people said, okay, I guess germ theory is legit. Let's wash our hands. So sometimes it does kind of go the long way around. But nowadays, I feel like we have experienced so many different things. I'm the kind of person who doesn't research or hear one thing. I have to hear 10 to 20 things and then base my opinion on that. I read about 50 to 70 nonfiction books a year on anything, quantum physics, a lot of business, marketing, healing in this way. So I've studied a lot, and we actually have proven and have studies for a lot more than we realize. So the studies of meditation were thought to be, I don't know if hokum is the word, but just nonsense, and the theory of the mind and things where our thoughts matter didn't really affect our body. But from the year 1999, there were about 900 studies related to meditation. And now there are over 11,000, and they're all showing progress. So now we have this sitting still that people are largely accepting. The National Institute of Health actually started backing a way to study people doing energy healing in the biofield. And this started I don't know exactly what year. And they added a lot of Reiki. They did funding. So there's actually, I think, like 3,000 studies related to Reiki. So we are doing this in the biofield. But what's happening is there's some inconsistency with the way energy practitioners are trained. So there's some skepticism there. There's some inconsistency of the ways that practitioners do things. So like some practitioners put their hands on, some practitioners do remote, some do distance. And so because of that inconsistency, there are all these questions. So, and then of course there's Reiki and then 30 other modalities that are used. But what they've noticed that whether these inconsistencies exist or not, they are making a difference. So currently, as of a survey from 2017, there are over 800 hospitals just in the United States that are using these practices. But instead of saying energy healing or Reiki as like blanket, they've changed the terminology to biofield therapy. So they're acknowledging that there's this field that affects us in living organisms. And they've done studies and theories for many years, but lately more and more have come about. And getting the research and the studies specifically to biofield therapy is really important. And essentially what remote spirit release is really working on that etheric, that biofield, and doing it remotely. And you have a consistent protocol. So because the medical community is open to this biofield treatment, they have created a checklist for studies. I don't know if you're aware of that. So when you say, hey, I have this biofield treatment, you go in and you fill out this checklist. And that way it's easier for people to search, to review, or easier for people to search to try to replicate, or search to see, hey, this study could be used in my facility. Can we replicate this here? So they're actually bridging some of the gaps already. So now we're on to the fringe, right? As you gentlemen refer to yourselves as sometimes. So if biofield therapy is on the fringe of medicine, and then you may consider yourself on the fringe of biofield therapy. And this, I think, is where we can dive into a little bit deeper of the science world, but just outside of medicine. So in a lot of quantum physics, so Einstein, we're all familiar with Einstein, right? So he had this theory of relativity, but he came across this thing where particles, his idea was that things that were in the local setting were affected by local things. But he found that things that were far away were actually affected, and it didn't resonate with space and time as we understand it. And it traveled what would be faster than the speed of light. Because in our science today, we think speed of light is the fastest as you go. And so he even dubbed the word, like he's a very scientific professional. He's like, hey, I found this. I'm going to publish it anyway. This is spooky. He used the word spooky. He's like, but here you go. All right. And so he has this entanglement theory. And you would say that that's even on the fringe of quantum physics. But really, in 2022, that was the subject of the Nobel Prize. I don't know if you're aware, but in the Nobel Prize in 2022 were people proving that particles, photons, and photons that are related to light and our biofield, some people refer to as biophotons, okay, are actually able to affect each other from long distances. One of the distances they did was out in space. One was like 1,700 kilometers. So they have this particle, there's this other particle. As long as they're in coherence, anything they do to this particle will affect the other particle simultaneously, right? So we're really kind of already discussing and proving through a Nobel Peace Prize that there's this coherence between energy, no matter space and time. And so, there's a lot of theories in quantum physics related to everything is energy, even down to the electron. There's a consciousness as well. So they're saying there's consciousness in all matter and all energy. So I think what will happen over time is, while you all use the word spirits, as science kind of comes to be, just as they changed energy healing into biofield therapy, they may eventually exchange the word spirit, because that's kind of loaded with a lot of what people have already associated with it and change it to something like energy consciousness, some scientific term, and then all of a sudden we'll accept it, just like all of a sudden we accepted germ theory. So I think we are closer than we think. I do know that with remote viewing, because a lot of people are skeptic about remote work, especially in the biofield. I do know of Carolyn Mize. I'm not sure if you're familiar, but she actually was a medical intuitive. The word psychic is kind of replaced with intuitive now. So she was a medical intuitive. And this gentleman from Harvard, a neurology professor, said, hey, you have this weird thing. Why don't we put it to the test? And so he sat her down and she did her medical intuitive from remote to try to connect to these patients. I don't know what kind of information he gave her, just the name or the patient number. And she was able to diagnose them with 92% accuracy. 93% accuracy. So this is huge. So they're saying not only is all energy already connected, but now we're saying that people have the ability to tap into this energy and successfully and accurately understand it. So now I'm not saying every person on the planet can do this right now, but there are people who are trained. And then I know a lot of your work is related to the psychology field. And it's funny because psychology actually currently has it's called spirit possession syndrome as a diagnosis. This is a diagnosis that patients could be diagnosed with. It's not common. People often will label it as different kind of mood disorders or schizophrenia or hallucinations or other things like that. But that was used, and the studies related to that are within the last, since 2000. I know that there have been studies related to spirit possession syndrome. But psychology has a lot of weird stuff. There's a diagnosis called synesthesia, where people actually interpret energy as color. So, for example, if someone speaks, they can see color coming out of them. Or sometimes color is associated with different numbers. And some people who see the color as numbers may not see the color as someone's words. But this is so prevalent that the Cleveland Clinic has said that we suspect that 4%, so 1 in 25 people, may have this ability, and we suspect it could be even higher. They're just not understanding what they're seeing or able to really develop it. It's more subtle. So now we're saying that all these people can potentially understand some form of energy. And the way that they're explaining that is your brain is kind of overlapping, firing neurons. So when your one sense is activated, another sense is simultaneously activated. And that's an oversimplification, so it's much more complicated than that. But so now we're open to the idea that our brain, you know how a long time ago they kept saying we only use 10% of our brains. Perhaps we do use a lot more. We're just not able to easily map. If I poke here, my left hand moves here, So all of these things could be an ability that we may lose over time or just may need to be nurtured, just like Olympic athletes have to really focus on their skill. So as far as the medical community goes, and I know I've been talking a long time, there's so many aspects of so many different sciences that have already acknowledged unseen energy, a connection that defies space and time, and people that have this ability to really kind of maneuver and perceive this kind of energy. So I think all that's missing is just the data. We need to not go to them and say, hey, you're doing this wrong. We have you're diagnosed. We're not challenging any aspect. We're going to say, hey, we've through the last 10 years or so, right? You've been working on this protocol and we fine-tuned this protocol. We have this 1,000 cases that we've documented, and you've done much more than that. We think this piece can go into your puzzle. And here's how we can do it. And so that's kind of how you present it. And so if you understand that your work is related to biofield therapy and biofield therapy remotely is accepted, all we have to do is really kind of outline it and put the work. And hey, we do da-da-da-da-da. All you need to do is just give us a number. And that's kind of where we're at right now. So they're ready. They might not be excited about it, but it's here, and all we need is the data to follow.
That's incredible. Thank you for explaining all that. It's certainly the layers are beginning to peel away, aren't they?
I've learned something.
We're seeing a way that we can actually get in.
So really, I guess from our perspective then, Candice, so how could a clinician determine the need really for the work that we do and the way that we do it, and how would you kind of envisage that happening really, so that we can start to move this into a kind of more convenient format, I guess, to engage with the medical profession?
Yeah, so that's really the key, right? How do we trigger activating this form of treatment? And I think with a clinician, if we can properly outline signs and symptoms. So for example, if someone presents to the hospital with a fever, or rapid heart rate, or certain symptoms, they would test for these certain protocols. If someone presents with something else, they would test with different protocols. So we really need to outline specifically what are the symptoms that we're looking for, what could this help? And I know that the way that you guys categorize yours, which I really appreciate as well, is you have different levels. And just like staging cancer or severity of illness in other ways, there's really different levels. So different levels may present as different symptoms. So for example, a level 1 that you may refer to could benefit someone experiencing chronic fatigue or some unexplained pain that there's like none of the devices, none of the screenings are really showing a reason for it, but there's this weird pain and it can't, so those might be the lower levels. And then you could also screen for different symptoms. Are they hearing voices? Are they, I would say beyond hallucinations, I think extreme mood swings. This is something that's not really testable, but it's in a lot of mood disorders where unexplained actions or things like that. So you would basically have kind of this checklist of these are kind of the symptoms of the people that have these issues that we were clearing, right? Because not all biofield therapies would do this kind of work. So you really kind of narrow down what symptoms specifically you are really managing. So I think you could even go as far as saying these diagnoses would be worth screening and worth checking out. And because it's remote and because it's done quickly, it would be really easy to say, hey, let's do someone with diagnosis of schizophrenia or diagnosis with borderline personality disorder, or someone who's recently been Baker acted. I think you guys call it sectioned, right? So a clinician would say, do we have these signs or these behaviors? Let me refer you to this treatment, or hopefully eventually we'll just add this treatment onto our plan.
So then really going back with your medical experience and what you're learning with us now as you're working through the course, the protocol that we have is unique to us, the spirit-guided remote spirit release. Now that you're working that protocol, who do you think would benefit from this work?
As far as the clients go, I think people who have experienced a lot of trauma are at high risk for this kind of energy interference. And I think people who are going through the steps of traditional therapy without getting success need that missing piece. I think I work a lot with the foster community and a lot of kids with trauma. And I was on the board of a nonprofit for a long time. And children diagnosed with reactive attachment disorder, I think would largely benefit from this kind of treatment. There's not really a medication for those kind of things. People who the medication helps, but there's still some prevailing symptoms. I was reading one of the studies from Seroquel, and one of the studies Seroquel does is they performed, because it's largely prescribed for schizophrenia and different things like that, and they performed a study, but all of their subjects were very mild. They were categorized as mild hallucinations. So, and then they had not nearly the success rate that you do. So they had some success, but still there were so many people that were still experiencing the symptoms. So I think family members who have a loved one or know someone that's struggling in a mental health way that they don't have an answer for. And one of the things that you all have said really hit me is a lot of these people kind of feel rejected and left behind. And I know of children with the right reactive attachment disorder that their therapist quit them. They're like, I can't do this. You're out of my skill of practice. And they literally get rejected by the people who are supposed to help them. And it's one of the things that was really profound, as you said, when everyone else steps back, we step in. So even just those desperate, right, that feel like there's nowhere to go. But specifically diagnosis, I think schizophrenia, I think borderline personality, perhaps bipolar. I think anyone who's been Baker acted, suicide. I mean, I know this is relatively new, but I envision the suicide hotline consulting an SRA practitioner every time. Like that would be fantastic dream of mine. And obviously, no pressure. I want you guys to get big, but I think in that way, people who, when I was doing a lot of research, I'd like to say, okay, what's there? What am I missing? I'm not want to reinvent the wheel if it's already there. And the U.S. News and Report ranks hospitals based on different specialties, right? So we have like neurology, cardiology, this and that. All these specialties, and the top 10 are often 80 or higher. So like the top one is ranked 100, underneath that it's 97, et cetera, right? When I looked up psychiatry, there weren't even 10 hospitals on the list. Wow. There were only 3. And the highest one was 13. So that just shows that there's just this gap, and not that anyone's intentionally doing something wrong. I think there's just pieces missing that they don't know what to do. And so that's why I think the people that would benefit are people who have tried some of the traditional therapies, people who have maybe been at high risk of experiencing this kind of energy through trauma, and people who feel outcasted sometimes.
I think that's amazing. I think what you've said has got so much that you need to take in and think about, and certainly going through the call centres and the helplines for people that are ready to commit suicide. In the UK, we have an organisation called the Samaritans, and if they would engage one of our practitioners, one of our professional practitioners, they would see a difference. So I'm absolutely convinced on it. From the feedback that we get from doing thousands of cases, I'm absolutely convinced that they will see a positive impact in engaging this.
Yeah,
I think that's incredible what you said.
Yeah, it's a really good point, mate, actually. And I guess that's one of the things that was on Dr. Palmer's kind of agenda list, really, was to try to find an organisation, as you've both said, like the Samaritans, these sorts of people that are engaging with people with severe trauma, obviously been through a lot of abuse, physical, mental, sexual, emotional, and they don't really know where to go. And then, of course, that basically creates problems from a kind of auric and spiritual perspective. And then we have this attachment issue, which then drives negative thoughts, schizophrenia, pushes that to self-harm, and then pushes that towards suicide. So this is our sweet spot where we actually can perform interventions. And of course, the key part of this work for me has always been it works very, very fast. It's not go and see a therapist for 6 months. It's book an appointment with a certified practitioner, and an hour later you feel better. That's the actual reality. And I guess that's the kind of data point that we need to get out into the general public, really.
Yeah. And being from the medical community, I really think it's important to also incorporate it into. So someone starting a new therapy program, or someone who we have this intensive outpatient therapy. So anyone who's in a program like that, risk for getting Baker acted or sectioned in the future, they're trying to prevent that. So anyone that would be in that kind of program would benefit from this healing modality, because then they might be more successful in that program. because I think a lot of this is preventing the success rate of all the things we already have. And I think that's the issue, is if we can incorporate them, it can be even better.
So I guess really from our perspective, Candice, that's been a really important part of this conversation, I think, really. And hopefully the listeners that are listening to this have picked up on that as well. So what would you say kind of sets the spirit-guided remote spirit release protocol that we've basically created, apart from other types of healing modalities that you're aware of, really?
So I respect all energy modalities, and I don't want to talk poorly about anything, but from a medical perspective, you need consistency. So Reiki is 100-year-old plus practice, but it went from years of apprenticeship to now there are people who can get certified in a weekend online. And it's not, if you pass this, it's like, if you purchase this, you're certified. And so now there are fantastic Reiki practitioners. I go to one sometimes when I need like a fill up, I don't know. It's like, but with you, the protocol is consistent. You have to apply to your academy. You don't just say, you pay me money, I give you a certificate. You have to apply and you interview and you filter out people who you don't think is a good fit. And then once they're in your academy, they have to finish the work. They have to do case studies. They have to demonstrate that they can actually do this practice. And that sets you apart from so many other people, because usually once you click finish, that you print your certificate. And that's completely different. And that's the standard of what the medical community needs. And that there's actually Healing Touch is a biofield modality, and it's kind of goes along the same fashion, and you actually get nursing continuing education credits for it. It's one of the ones that are used in the hospitals a lot because it is so structured, and because by the time you get to be an independent practitioner, you've had to work underneath someone and demonstrate and videotape that you know how to do it. And then they have specific biofield techniques for specific issues. And so for you, you're also doing that. You have this remote biofield technique that follows a very specific protocol that can really target certain specific issues. It's not this same thing can help anybody with anything. This is more specific protocol, specific modality. You have to truly do the program, and you have to truly know what you're doing in order to call yourself a SRA practitioner. And that is the level of training that's needed to really push this forward. And I think that really, I don't know if you trademark your stuff or how all that works. But when we do these studies, it really has to show like SRA trained practitioner, because there are spirit release modalities. Like some people do it in hypnotherapy, some people do it in Reiki, there's a variety of different ways, but we want to know that our numbers show from SRA practitioners, so it doesn't get confused with anybody else doing something that they may have like learned in a less rigorous setting.
I think you're absolutely right. And for the reason that you've spoken of, this is why we protect the phrase spirit guided remote spirit release, SGRSR, because that is unique to us. That is unique to the academy, to the way that we work the protocol, to the way that we evolve it, which then also means it's unique to our practitioners. So we do. This is the sole reason why we went through that, because spirit release covers a huge scope. And there are many, many modalities and many, many people that have their own interpretations. And one of the things that Andy and I say quite often is that when someone asks you what you do and you say you're a remote spirit release specialist, they often say, well, I do that. And we think, not the way we do. And it's not an arrogant comment. It's not meant to be anything else. The majority of people consider spirit release to be perhaps one level of work, whereas, as you know, Candice, in our protocol, we have over 20 levels, of which the one level they're referring to is just one of our 20. So it's a very, very in-depth protocol that we have. We believe in it because we've seen so many cases come through. And certainly working with Dr. Palmer, the case studies that he did, the 1,000 case studies, we need to get that out there, and we need to improve it. We're currently on an 80% success rate. We need to find 85. And then when we get that, we need to find 90. And this is really where people like you are going to come in. We have so many different types of practitioners that come through the academy, but we're getting more and more people come in with PhD level. And really, I guess what I'm asking is, how do we even sort of make a study for this work? How do we actually bring that in?
So I am that person who some people daydream about different things. I daydream about this kind of stuff. My husband actually teaches psychology through the Cambridge program. And so our dinner talk is just sitting around talking about studies and analyzing studies. I'm like, how would you make a study for that? So I've been thinking about this long before I met you guys. So I'm really excited. So what any good study needs is your protocol really sets you up for success. I'm going to say that because the limitations of other biofields therapies are, one, you are very specific and unique, like we just expressed. So you can't just grab any Reiki specialist. And I'm not saying anything's wrong with Reiki. Like, I love Reiki, but you're going to get really inconsistent results from different Reiki specialists, right? So if you say you're SRA practitioner in this study, it's going to be very consistent. The fact that you can do it remotely really takes away a lot of your limitations that other people would experience in studies, because you're not limited to where you can drive. Like, you're limited to who can make a phone call and click on a document. And then I was thinking of 3 different forms of studies for you. One form would be based on kind of what we talked about before, related to certain diagnosis. You would take patients that are in treatment with these diagnoses, and your control would be the current algorithm of medical treatment, right? What they're already currently doing. They're already on this med, they're already on this, they're already on whatever. And then you take random people, because randomization is so important. You could take, a list of one mental health facility and just go list them in alphabetical order and pick every other one. Like, you could be so easily random in that way. And say, all right, we're going to incorporate this protocol. And then what's your aim? What are we trying to figure out? And then I think in this study, you would figure out, one, decrease symptoms, right? That's the most important. 2, one of the easy things about this is they're already filling out these forms. Every time someone goes and sees a mental health professional, and even a lot of times your primary practitioner, you answer these certain questions. So there's a scale for anxiety, there's a scale for depression, there's a scale for different things. So they already have these accepted scales. So all they would do is continue to answer all these scales, all these questionnaires that the medical community have already said, hey, this is what we follow, and see how that's different. I think that even in a short period of time, the results would demonstrate something significant. And then, of course, you would have to document, do any of these people experience any side effects or any not negative experiences, or how long do they last? I know that in some medications, it takes like 6 weeks to feel effect. So I know sometimes that you express that it can take 5 days to fully get the healing. That's still very quick, right? So one study would involve people who already have these diagnoses. We take a random sample. The patients would not know who they are, so that's blinded. And then the people, the therapists, they don't have to know who's going to be receiving the treatment, so that's extra blinded. And then your mediums, they never know. Your protocol, they never know. You're already always blinded and unbiased, which is fantastic. So that's blinded. So the level of people who can taint or really affect it in like a way that you're like, well, maybe because they were watching, is all eliminated because of your protocol. I think another study that I was thinking about is having a behavior, or like I said before, people who are starting a new program, like an intensive outpatient program, or people who are Baker acted. Now, being Baker acted, I think, is tricky, because in that space, there's going to be a lot of energy, right? So you might need to do like a clearing upon and arrival, a clearing upon discharge. But then you can also measure, are they medication compliance? Are they following up with their next appointment? Do they report a decrease in symptoms? And you can really see long term, because a lot of people that have these experiences of being Baker after, they're repeats, or they don't go to their follow-up appointments. And so I know sometimes people are always worried about with energy healing, like, aren't you going to get in trouble with big pharma? And I'm going to be honest, like, this is not their big moneymaker industry. Like, if we are taking on cancer or like chronic inflammation issues, rheumatoid arthritis, like that's where they bank. These people are largely inconsistent with their medications. A lot of these medications are not really intended to be lifelong medications. And so this would actually increase compliance, and maybe they need a smaller dose, but they actually would take it for a more consistent period of time. So I think that in that way, we're not really going to have an issue. And then I think the last study that I was thinking, so based on diagnosis, right? And then based on experience, like behavior, like starting a certain program. And then I think the last, which would be amazing, and this would be kind of tricky. There's this book called Spark, and this is unrelated to this, but what they did is they decided that exercise is important in schools. And so they made every child have their first period be some kind of physical activity, and they actually wore heart monitors and really show that they were increasing their heart rate. And a long story short, it actually not only increased the academics to an exceptional level beyond what that school has ever seen and beyond what most schools are, it also decreased the level of violence school-wide, and just showed just the overall well-being increase in the school. So I think, which would be tricky, is to also do a study based on an entire facility. So pick a facility that have people inpatient. So there's SIP programs where in a reactive attachment diagnosis, often after they're Baker acted, then they get put in this long-term stabilization program called SIP. And if you could get SRA into this program and everyone into this like one particular facility and truly like work with the property, work with the building, work with all the patients, you could really show this facility with this intervention compared to this facility, would just, I think, could be profound. I mean, but we also have to take the scientific approach. Let's see what happens. Let's see where the numbers lead us, right? But those are the three kind of ways that I think we could do it, based on diagnosis that are already in treatment, based on people about to start particular treatments or have been sectioned or Baker acted, or a particular facility to incorporate it fully into their program.
Perfect. That was amazing, Candice, actually. That was really good. I think you've brought up so many things that, I mean, you and I have talked about this, mate, for a long, long time, haven't we, in terms of how we kind of cross these barriers. And one of the things for us really is we've never really seen the work that we do, and Terry didn't either, to be fair, as a kind of instead of big pharma or instead of medication. The work that we do kind of augments medication. It should be alongside complements. Should be alongside the medical kind of intervention, really. So it doesn't have to be people stop taking medication and then do meditation. The two words were kind of on tip of my tongue there, but that type of concept whereby we are kind of aligning this thing alongside all of the current accepted practices. It's just a different way to see things. And obviously we're looking to perform our interventions from a kind of spiritual perspective, which we know and we see works. And obviously Terry literally documented 1,000 cases. But if you look at all of the work that I've done and Jono's done, just ourselves, two practitioners over the last 15 years, we've probably done 10,000 cases, just that they're not documented. So again, we're doing them all day, every day. And I send feedback forms to all of my clients, but the rate of return is quite tricky, really, to try and get people to give you feedback, because quite often they're recommended by friends. They book an appointment, they feel better. It's kind of what they expected, but trying to get them to give you the kind of like scientific feedback is actually quite difficult. And that, I guess, is the thing. When we look at the numbers, they are huge numbers. And again, you know, if we could go back and contact 10,000 people, we probably could come up with some amazing feedback, really, which is maybe something we need to consider too. So from your perspective,
sorry, I was just going to say, based on what you do, I would make the suggestion as I know some of the bookings are kind of this urgent, extreme situation, but for those who may not be, perhaps as part of your booking, give an initial survey. Like, what are you experiencing? What are your symptoms? And I know the mediums have to be like, don't know any of the situation, but because that's when you go to a hospital, you're like, this is what I'm experiencing. And then after they acknowledge, because sometimes just saying out loud or checking a box really is part of it. And then if you send the follow-up, like, hey, how are you feeling better? People may be more like, yeah, like I don't have to check that box anymore. I'm no longer, you know what I mean? Because then it's kind of, in my opinion, that may work better is to have kind of like an intake form of those questions and then like a post.
It's a good idea, actually. It's a really good idea, actually. Yeah, we're definitely going to put that onto the board of things to do.
It's all about making the boat go faster, isn't it?
It's what we do.
All about making the boat go faster.
I mean, if you really wanted to get crazy, you could add some of the medical questionnaires, like actually do the ones for depression or, the ones that they're already accepting. Because then if you're comparing the specific questions that they're already using pre and post, like that would really add validity, even though it's outside the clinical setting.
So yeah, it's a really good point. I think that's good sort of directive drive really from you. Thanks, Candice. So really moving on. So in terms of like questions from cynics, I guess, because obviously what we're doing is, is spiritual. We know it works. We see it every day. To us, it's just, it works really, which is why we sit here every day and do what we do.
And do what we do, yeah.
So where are you on the cynical aspect? Obviously, spirituality wasn't really your thing. So you're a really interesting person to kind of give us that opinion really.
So it is so funny. I don't know if you ever have this thought in your head, like if I were to talk to myself when I was 20, I would never have thought, XYZ would happen in my life, or if I were to talk about this. But for me, this conversation right here, if I were to tell myself 5 years ago, this would be happening, I would say, no way. I was raised in Christian faith. I kind of became a little agnostic as I developed my scientific study. Unfortunately, our culture really divided that a long time ago. And you kind of feel like you have to choose, and it's difficult to live in both worlds. But then, of course, my personal experience kind of brought me back to meditation. And while meditation is not as much of a thought of as a spiritual experience, if you meditate long enough, chances are you may become a spiritual person. Connected like that. It really does. And so it's amazing though. But I think if we were to really talk to cynics, right? If we were to really have these deep conversations, one, let's get those out of the way early so we can address these concerns. Cynics are sometimes your best people to really experience from the foundation, because then, you don't put in this work 5 years later, then you're like, oh crap, I never thought of that, or I never, and then cynics are just everywhere. The first vaccine was smallpox, right? And it was derived from cows. And so not only do the church reject it for affecting divine power, the medical community rejected it because we were injecting illness into patients, and the actual population rejected it because they thought people were going to grow cow parts. Lo and behold, the smallpox vaccine is like the first disease that was eradicated from the planet. Like there have been no known cases in over 50 years, and that's fantastic. So, cynics are always going to be there no matter what work you do. And I think the biggest cynical questions that we need to address are the worry that we're going to be challenging people's beliefs, right? I think that when you go from a scientific approach, everyone can still have their beliefs, but you kind of take the belief out of the process. Does that make sense? A lot of times everyone will catch up when you just have the numbers behind it. I think that modern medicine is going to change. So this protocol, I think, is phenomenal. And even if you tweak it slightly, I think this is a real successful thing to truly incorporate. But once it's accepted into the medical community, they may like I said, switch the word spirit for something medical, and they'll say they discovered it. But nonetheless, the protocol is still valid, right? No matter what you call it. I think another thing is the fear behind this kind of work. You know, in the church, they describe any kind of entities as demons, and being raised Christian, like, we acknowledge the truth in the Bible, and we talked about angels, but no one really talked about the dark side of it. And in my understanding as a kid, that's just something that Jesus had to deal with. That's not really here right now. And so bringing that up to the surface is a little frightening. And I think that there are some people that may not believe in spiritual practices, that if the data really shows that this helps, okay, well, if I have to believe this exists, what else do I need to believe in? And then it can really challenge a lot of their understanding of the world. So I think if we just, understand that this is a kind of energy with consciousness, which science is already accepting, right? There's multidimensional quantum theories also, that there's different dimensions existing simultaneously. Like if you go down to a specialist that's really studied their craft, like, they're going to be like, oh yeah, that makes sense. You know, that's not that crazy to them. But I would say that as far as fear goes, this kind of work and this kind of acknowledgement of this energy is no more fearful than germ theory, right? Acknowledging this invisible thing that can affect people and even kill them exists, but we have a ways to treat it. Here's how we empower you for your health. We can help you. You know what I mean? And then in addition to that, we can teach you how to protect yourself from this in the future. And that's kind of similar to the evolution of germ theory. And it's really about empowerment, because these things are here, whether we say acknowledge it or not. And I think that creating that empowerment and treatment, we'll think of this kind of energy as casually as we think of bacteria. And honestly, bacteria hurts a lot more people than this kind of energy. So I think that we're still okay.
I think you've completely wrapped it up in exactly the way that we think. Energy is everywhere. Multidimensional energy is everywhere. Entity is everywhere. And I think the fear factor doesn't come from us, because we try and empower people. We certainly do not try and spread fear. We're here to help people understand that energy is there and controllable. And you can control it, and you can look after it, and you can move forward yourself, being completely empowered by your energy. So I think what you're saying, sort of going back to religion and Hollywood, I don't really think that's sort of done the reality of our work many favors. But the cynics, these people, I think, are very important to us, because when the cynics come forward and have the work, they then become part of our evidential belief. Mm-hmm. And they make a huge difference to those around them, their family members. And this is one of the reasons why we sort of pick up the work, is because you do some work for a family, you do some work for a client. And then the next thing is you get their family members, and then you get their friends, and then you get their family members, and then you get their friends. And it's like an organic growth of work, really. But it usually starts with somebody who has maybe an idea or half a belief, and then it's normally confirmed by the cynic who feels better. So this makes a massive, massive difference to us. And certainly moving forward for the future, what do you think is needed now to assist in that process, to make it successful?
I think right now we really need to, one, get those numbers in our research, but two, also, we have to change the culture of how we think of this as humanity. So I'll use an example. And this is random, but UFOs are really charged topic, right? Like, there's a lot of controversy, and I don't know how your government works, but our government is usually a gaslighter, no, it's a training exercise. But a couple years ago, the U.S. Navy saw these UFOs flying over water. And it was a lot of people. And so they all saw it together at the same time. And not only that, they were able to, like they're navigate like to target where they like got it on target, and then it was able to follow like its movement and stuff. And then this didn't happen once. This happened most days over a 4-month period where these people just saw these things. So a couple of years later, the government's like, all right, this is legit. You all are talking about it. They've even testified for it. They said, okay, and I don't know when exactly the name change happened, but UFO is now referred to as UAP because that's the process. We're going to change the name and then we're going to accept it. Right. So it's now UAP. And they've actually even released some of the footage. So like, this happens. Here's the footage. Hey, science folk, if you want to give us feedback, come here. And so I think sometimes that's what we need to do in this environment. Is this might be that fringe topic that's not easy to talk about, but our culture needs to provide a safe place to discuss this. Now, I had my personal experience, and I found that anytime, so I work in the foster community and I've adopted some children. And whenever I bring up adoption, all of a sudden they're like, oh yeah, I was adopted, or my so-and-so was adopted. And it's just everywhere, right? And I think in this situation, if someone were to say, hey, I had this treatment and it really helped me. And then someone else will say, oh, I'm experiencing something weird, or oh, my so-and-so is this. And then it'll kind of spread, but we have to allow people to discuss it and embrace this thing is going on that I don't understand. And then we also just need, I'm going to tell you, healthcare professionals are phenomenal people. All right. No one goes and does the work of being a healthcare professional with the intention of just sucking. Like, they want to make people better. And I think some of the burnout is their limitations and poor success rate, especially in the mental health community. So I think if we were to really start opening this conversation with, hey, we have this technique, let's try it. Let's get our studies, let's get our data, and they'll kind of present this data, and it'll give them a safe place to open it, because the medical community is restricted from their protocols. Like, they can't just Wild West, try new things, like, because they have to respect the requirements under their license. So they can't always acknowledge these things. So they do have to label it with the accepted diagnosis terms. And there is a history of people being pushed out that talk about it. But even for my example of my loved one, I went to one of her sessions and her therapist said, she's so much better. Oh my gosh, what happened? Like, tell me. She's like, I am really open-minded. Like, she was like leaning in and just like waiting for me to share. And at that time, I wasn't brave enough. I didn't tell her what we did. I'm just like, yeah, we tried this Reiki thing, but didn't really acknowledge it. And so we need to have that safety, because perhaps if I would have acknowledged, hey, this is what happened, and you see the difference, maybe she would have advocated even more to talk about it with her patients or her family, and et cetera. So we need to offer the safe place. We need clients and patients to know what to look for, and to say, hey, is there a study? Hey, this isn't working, let's try something new. Like, desperate folk will do anything, right? So these clients may not have the support of the practitioner, but they're at the point where if it's being, into an asylum or into a family, like they're willing to try everything, right? I think as far as so we need to have kind of a call to action to like medical practitioners, and that kind of is on us to open the door of communication with them. I think as far as medians go, because you have such a specific need for your team, to really, promote and understand like mediums with a mission. You're going to need a lot of practitioners. I really think this is going to grow. And I think I'm going to give you all a challenge, if you're okay with it. Okay. And it's a big one. But sometimes I just say things and hopefully you forgive me. So what I do in my life and where I feel like I'm going is I want to really help shift the way we help people in healthcare. I believe that the protocol and SRA can be that first step for so many different treatment options. And I think that's one of the reasons I'm here is because you have to start with step one, right? So what I've discovered is there's all these islands of all these beautiful people doing all these amazing things. And you all are fantastic on your islands. And what I would like, if you're willing to do, is to truly just like keep building that pyramid on your island. I would like to send potential client to your website and have them never have to Google anything, because there's just so much information there. So you have some of these protection protocols or this protection sheet, but then I found, I'm like, okay, well, what crystals, what meditation, what, you know what I mean? And honestly, if you would be open to it, I think it would be fantastic to even have a e-commerce page where you can sell even just meditations. Right. So there's so many meditations on YouTube and all this other stuff. But if you sold like huge quality meditation that's really been thought out for what your purposes of protection, or even you could have a 5-minute one, you could have a 20-minute one, you could have a bedtime one, you could have whatever, and they could buy them for like $5, $20, whatever. I know Joe Dispenza charges $25 for his meditations on his site, but just to have something that that you can rely on, right? Something that is a high quality, because you can get some of these different things from anywhere else. But if you are truly that peak of that pyramid on your island, and they know that you are the ultimate resource, and they're not going to have to go Google something because you've answered that question. Does that make sense? Is that a lot? No pressure.
No, I think that's certainly challenge accepted. I mean, one of the things, particularly with the meditations that you're talking about, we do have a free meditation on the SRA, spiritreleaseacademy.com website that helps with grounding. And we are in the process of getting a list of what we would consider to be the most important meditations together. The biggest obstacle that Andy and I have for anything at the moment is time. But this is happening. We are going to do it. It is in our thought process. And sooner or later, that does mean that it will be on the website. But hopefully sooner rather than later.
We're on it.
We can do it.
Definitely.
We'll do it.
Yep.
We'll have a chat after this podcast and we'll get it all booked in. And it will be on there at a website near you. We'll definitely do that.
Perfect.
I think what you said, Candice, is absolutely incredible. It's great to have the company of somebody as experienced as you in the academy, and your viewpoints are so valid. And you are, and also there are a couple of other practitioners as well that are becoming the missing link within the academy, something that we've been looking for so long. Dr. Palmer is a big loss, a very, very big loss for many, many different reasons. However, where there's a gap, we can fill those gaps. And this is where we see you. This is where we see a couple of the other practitioners. We had an excellent podcast with Miriam as well. And I think collectively, yourselves, with your knowledge, with your qualifications, with your understanding, as well as what we do on the spiritual side, I think that is going to be the perfect blend moving this forward. And I have no fear of skeptics in any way, shape or form, because they're the next people that are going to become believers as far as I'm concerned.
Yeah, it's really
and they speak the loudest to advocate for what changed their mind.
They do. Absolutely.
And to be honest, I was a skeptic 20 years ago.
So was I.
So we both are those people. And I think from my perspective, Candice, thank you for being open-minded enough really to join and have a look. Because when people open that door at what we do and how we do things and look at the research and documentation, suddenly it doesn't become woo-woo, it becomes fact. And when you realize it's fact, then what we realize is people like yourself are the visionaries of tomorrow. So Dr. P came, picked this up, developed it, obviously passed on, dropped it kind of in our laps really. And people like you are kind of the next people to pick that baton up now, and you can see how this works. We know it works. We do it every day. We just need to get that information into the general public. And then effectively we can really start to help people that are going through such terrible traumas that is so easily resolved. Because that's the whole thing. This isn't a go on a year's worth of training program or change your habits. This is a very, very quick intervention and a very cost effective one too.
I mean, can you just imagine the impact you'll have on just the family? And you already do have this impact, but just so people go to these healthcare professionals and they're doing the best they can. And they're saying, well, that's in your mind, or that's not real, or you're misguided, and then they're doing these behaviors that they don't understand, sometimes don't even remember. And to have someone explain, like, hey, there's something else here that's affecting you, and to remove it, and to allow them to give themselves that grace and that forgiveness to understand that they had an obstacle. Because sometimes I feel like in these circles with this kind of energy that you guys are working with, we're really condemning the patient as if, if someone got pneumonia, like, you're bad, and but it's just something else that's affecting them. It's invisible, like bacteria. And we have to give them that freedom to heal and that ability to forgive themselves, because just sending them to jail or the asylum just isn't, you're giving people answers that no one else can, in addition to the healing. And I think that sometimes that peace of mind is so important in addition to just feeling better. And I think that will also trickle in waves beyond what we can understand right now.
Perfect.
Candice, we're going to leave it with that, because I think that is the perfect way to finish this podcast. So we're going to say goodbye, and thank you so much for your time. So thank you so much for your expertise. And I'm sure that we will have another episode where we delve a little bit deeper. And we look forward to working with you through your certification and through the Academy for many, many years.
Thanks, Candice. Enjoy the rest of your afternoon, morning, day, and we'll catch you again.
Take care.
All right. Thank you.
This podcast is sponsored by the Spirit Release Academy. To learn more information about the Academy and their ongoing courses, please visit spiritreleaseacademy.com.